Namaskar friends, I am your course instructor Dr. Shubhra Sinha and today we are going to do lecture 5 of module 4 of the stress management course. In this lecture, we are going to talk about a very critical issue which is appearing nowadays quickly and has become prevalent in all stages of education, that is student suicide due to scholastic stress and increasing societal pressure. In itself, it is a very disappointing fact and we need a significant and sincere reflection about this problem so that we can make improvements in it in all possible respects. First of all, let us have a quick review of what we are going to cover in this presentation. The first point is the suicide behavior in India, that is I am going to present some facts about the suicide behaviors and its prevalence in Indian society, its potential causes and the personality characteristics of the students which can make them more vulnerable towards stress or more resilient in responding to stresses will be discussed. Moreover, we will talk about the preventive measures for such problems, specially mentioning the initiatives taken up by the Government of India. So, let us begin with this presentation. Suicide in India due to scholastic stress is a critical and escalating issue, and as per the data of National Crime Records Bureau, there is student suicide in India due to scholastic stress is a critical and escalating issue, and as per the data records of the National Crime Records Bureau, in 2022, 13,044 students committed suicide, accounting for a significant percentage of the total suicides in the country. Students of different age groups are affected by this problem and it is expanding downwards, that is this tendency is now visible in younger students as well. The reasons behind student suicides are multifaceted and interconnected, which refers to the complicated nature of this problem. And scholastic stress may act as a precursor as well as a trigger exacerbating the problem further. The primary causes of student suicide are academic pressure and competition, parental expectations, inappropriate parenting style, any mental health issue which is already present in the student and which may get aggravated due to the presence of scholastic stress, and social stigma regarding seeking professional help for mental health issues. We have talked about the intense competitions for securing a seat in a prestigious course or in a prestigious institutions. We have also talked about the parental and societal expectations as well as the expectations of the individual himself regarding the professional success, regarding the kind of profession one must choose, and also the overemphasis on certain careers in order to bring pride to the individual as well as to the family. When we think about parenting style, one must understand that being too strict, being too demanding as is shown by authoritarian parents, or being not involved in the child's academic pursuit, which is shown by the neglectful parenting, can create more stress than the authoritative parenting, which keeps a balance between demand and acceptance, that is warmth and support provided to the child. A number of students suffer from mental health issues like depression, anxiety and stress, which often go untreated due to a lack of awareness. Now, this can become a background for stress, which is then triggered by a single stressor in the life whenever it comes during their student life, leading them to depression and in ultimate cases suicide. Then the support system available in many educational institutions lack sufficient counseling services and mental health infrastructure. Therefore, students who face emotional and psychological distress cannot find appropriate support system to deal with it. Bullying, peer pressure and social isolation are additional problems which exacerbate the issue of scholastic stress and mental health issues. Financial burden again comes to play when we talk about education in India, and there is a constant pressure to secure a good job in order to support the family, and it can also add to the overall stress experienced by students. A lack of coping mechanism and poor emotion regulation skills can make students more vulnerable to suicidal ideations. Let us talk about the important personality characteristics that contributes in accelerating or increasing the perception of stress or decreasing the level of stress, at least as it is perceived by the student. So, first of all, the factors which can make the student more vulnerable towards scholastic stress, thereby towards suicidal ideation, are perfectionism, neuroticism, that is heightened emotionality and especially being driven by negative emotions, low self-esteem, when the adult or the child lacks self-esteem or self-confidence, he or she does not carry very positive conception of oneself. This is called low self-esteem. Poor coping skills, impulsivity, that means a tendency to enact or to say whatever comes to one's mind without giving it a second thought. Sometimes this impulsivity puts the person in very problematic situations. So, impulsivity can be a trait which creates a problem for the student and which can push him or her towards suicidal ideations, and not only ideations, towards proper acting it out. Hopelessness can be an issue, and social isolation, where the adult or the child is cut off from the social network. Therefore, he or she is not telling the problems to other people, they are not able to seek advices from other people, they are not able to share their experiences and learn the experiences of other people, which can perhaps make them learn that they are not alone in this world to suffer from such kind of problems. Here is another list of personality characteristics, but these characteristics are important to make the person resilient, to make the person answer back in face of difficulties. Conscientiousness, optimism, that is positive outlook towards future, high self-esteem, effective coping skills, learning appropriate skills of emotion regulation, strong social support system, and grit and resilience are important to make an individual strong enough not to be overwhelmed by the anxiety and stress, and must not think about steps like suicide. When it comes to suicide prevention, we find a lot of efforts being made from the government, from the institutions, and from the family as well. Here is a summary of those interventions that can be made to control the problem timely. For example, the educational institutions should move away from a sole focus on high stakes examination and promote a more holistic and continuous evaluation system, which means instead of taking one examination as an end semester exam, one can have monthly unit tests where the students have to prepare a small portion of the syllabus, and this gives an opportunity of continuous assessment of the student by making it easier to understand which students are performing consistently and and who are the people who sometimes prepare very well, but on the other times they suffer from a poor academic performance. If this inconsistency, such discrepancies are noticed, those students can be approached and their personalized problems can be handled in a more customized fashion. Moreover, the educational institutions should focus on creating a less competitive and more supportive learning environment, which can significantly reduce the students' stress. School and colleges must also prioritize the mental well-being of students over the grades they get in their school examinations by establishing robust counseling services with professionally qualified counselors and psychologists. Integrating mental health education into the main curriculum could be a good idea to raise the awareness about such issues and to reduce the social stigma associated with it. Peer support programs can also be designed where a peer group can become a safe space for students to share their concerns, to express their grief, to express their concerns. Parents also need to adopt a more supportive and understanding approach, focusing on their children's well-being rather than solely on academic achievements. Teachers should be trained to identify the signs of distress in students and act as empathetic support systems instead of simply behaving like a teacher who is very strict and only knows to punish and scold children for not completing the assignments or for securing not good grades and for not securing good grades in examinations. Educational institutions can implement a strict anti-ragging and anti-bullying policy. This will ensure a safe and inclusive environment for all students coming from diverse socio-cultural contexts. Encouraging participation in sports, cultural activities and extracurricular activities can help students manage stress and develop a sense of belongingness. Personality development programs can also be taken up so that the students can be equipped with better coping mechanisms. Fostering resilience through the development of adaptive coping skills, promoting a positive self-image, encouraging healthy emotion regulation and building strong support systems are crucial components of suicide prevention efforts among students facing high level of scholastic stress. Telecounseling services and online mental health platforms can be a good options as they provide easy and accessible destigmatized support to students, especially in remote areas where building infrastructures physically is challenging. Training parents, guardians and hostel wardens to recognize early warning signs of mental distress and suicide ideation is crucial for timely intervention. In this respect, it is also important to mention the government initiatives taken to reduce this problematic issue in students. National Mental Health Policy, which is made by the Government of India, aims to provide mental health infrastructure and raise awareness towards it within educational institutions. Manu Darpan initiative launched by the Union Education Ministry provides psychosocial support to students through a national toll-free helpline number and website. National Suicide Prevention Strategy formulated by the Ministry of Health and Family Welfare provides a framework for multiple stakeholders to implement suicide prevention activities. Tele-mental health program, which is also known as Telemanas, launched in October 2022, is a 24/7 free tele-mental health service aims to provide accessible counseling and care across India. Similarly, the University Grants Commission regulation has notified regulations to curb ragging and promote the well-being of students in higher educational institutions, including the establishment of counseling centers and grievance redressal mechanisms in all higher education institutions. Supreme Court has also set up a task force to investigate the causes and suggest preventive measures for suicide in students of higher education. Guidelines on self-harm, popularly known as Ummeed program, which is proposed by the Ministry of Education, has proposed guidelines to help schools, families and communities understanding and supporting students at risk of self-harm. There is a provision of supplementary examination which has been provided by many universities. Even in schools, this has been successfully implemented in Tamil Nadu. So, what they are doing, that they are providing a second chance to students to appear in the examination and pass it who fail in their first attempt. This may help reducing the stress associated with failure. If a person realizes that this was not the last chance, I still have one more chance to crack the examination and move on to the next level, it may be a source of relief for them. Toll-free helpline numbers are available, including a national helpline number 104, which provides immediate support to students in distress. The Dinner with DM initiative in Kota also allows students to directly interact with district administration official for support. This must be mentioned that Kota is a big hub of coaching centers, and after increasing number of student suicide, their district management system has introduced programs like this, Dinner with DM. The new Education Policy 2020 aims to reform the education system to be more holistic and multidisciplinary, with a focus on reducing academic pressure and providing multiple opportunities for assessment. So, this was all about the preventive measures that can be taken up at various levels, means at the level of individual, at the level of institution and at the level of the government. And here is the recap of what we have learned in this lecture. So, in this presentation we learned about the prevalence of suicide ideations or suicide behavior in students' fraternity, potential causes of committing suicide including factors associated with family, institution and peer group. Preventive measures were also discussed that can be adopted at various levels to reduce the incidences of student suicide. There was a special mention of the personality characteristics to foster resilience among students. Inculcating strength in students' personality, which is also known as resilience or hardiness, is very important. then only a person can face the challenges of the life successfully. Otherwise, there is a chance that the individual may get overwhelmed by such stresses and can take self-harm mechanisms like suicide. Various government initiatives for the prevention of suicide were also mentioned. These are the references for further readings. Here are some more. You can go through these references also. That's all for today. Thank you very much for your kind attention.